I think there's a lot of things that go into this. First off is an acknowledgement that this is happening, that this is life disrupting, that this is something that could occur. Secondly, I think knowing that there's a chance that this can get better can be very comforting to a patient. Thirdly, I do think that there's a lot of information out there to give to patients, and so just getting some information out there from the American Urogynecologic Society or the International Urogynecologic Society can be helpful. And then finally, someone who provides care in obstetrics, a midwife or an OBGYN provider, can start the process by getting a referral to the pelvic floor physical therapist. I think open and honest communication can be really helpful. That acknowledgement that this is one, very common, and two, nothing to be ashamed of, and three, there are a lot of treatment options available. I think that's as important as acknowledging the impact that this can have. Well, I'm never gonna say should, because there are a lot of things that come into play at a postpartum visit. I always tell my patients, I try not to take myself too seriously, but urinary incontinence isn't always the most important thing. Let's say someone has high blood pressure. There are a lot of other problems that high blood pressure can cause, especially in the postpartum period. And so that's something to address. Again, acknowledgement, information, education, pointing patients to resources that already exist. I think it's probably really helpful if each individual healthcare system could come up with a pool of resources and postpartum education that you go home with from the hospital, or it's something that a new parent is going to receive in the third trimester. Because in the postpartum period, a parent may be thinking about when their child is going to sleep, when the child needs a diaper change, when the child is going to eat, when they themselves are going to sleep, when they themselves are going to eat. And so having information that that parent can access on their own time at whatever time they need, then there's enough information and resources for both the parent, and this can also help the provider as well. As everyone knows, it's become even harder to get in to see a subspecialist, whether that be a physician or a pelvic floor physical therapist. Every physician cannot talk about treatment options for urinary incontinence. Not every physical therapist can address pelvic floor disorders. So as long as someone can get a referral in early, the earlier the better, just because there have been long wait times around the whole country. Early referrals are an important first step. I think this provides an important peace of mind and an important piece of information to a patient to let them know that help is coming and that they have someone that they can talk to about this and provide them with a variety of treatment options. Talking to a postpartum person about prioritizing themselves and their own health is really important. People tend to prioritize the infant, so it's really hard to focus on yourself. If your physician or your provider is the one to tell you that, it makes it easier to prioritize yourself. Mental health professionals can play a huge role. There's so many things happening that the people around the postpartum person or even that person themselves may not understand. It's really empowering and helpful to kind of talk through some of the changes that are happening in the body, things that make you anxious, and just a person of support who can be there for you. I think open and honest communication can be really helpful. That acknowledgement that this is one, very common, and two, nothing to be ashamed of, and three, there are a lot of treatment options available. Knowing why someone would be weary or stressed or anxious to go out and about, I think that is really important to talk to a patient about, and just encouraging them. Being open about this with their friends and family or other supportive people can be really helpful. There are also support groups that people can join or online communities that people can join so they can kind of review and understand that a lot of people are dealing with this and that there are a lot of things that one can do to help out with this. I think starting off with simple Kegel exercises can be really helpful. And if you don't know how to do that, looking for an online video on YouTube or social media sites, look for one from a licensed pelvic floor physical therapist. And if you can at least start doing that at home, it can definitely be beneficial to your symptoms. I tell my patients a lot, it's common, not normal. And I think that's a first sense of relief. If you're able to tell a patient that there's a chance this can get better and there's definitely treatment options that we can give you, whether they be surgical or non-surgical, that's really important. Handing out resources from the Voices for PFD website, like from the American Urogynecologic Society, can be very helpful. Again, there's a lot of videos on YouTube, whether that be on Kegel exercises, just a video on diaphragmatic breathing. I think these are two things that can really help people at least have a peace of mind and ease of mind that there is something that they can do to get started. And I don't expect every single provider to be able to counsel a patient about every single treatment option. Knowing what is available out there, at least to start with some education, some videos that can be helpful. And then just telling a patient that it all depends on what their goals are, whether they want more children, what treatment options they'd like to consider, whether they want something surgical or non-surgical. Physical therapy, knowing a little bit about what a Kegel exercise is and being able to do that at home can be very helpful while you're waiting to get in with a subspecialist. Women's health in general and taking care of people who have babies and who deal with issues after having children is poorly funded in this country. And that's from research, compensation, to other resources. There are long wait lists to see subspecialists for a myriad of concerns, especially urinary incontinence. If you're a pelvic floor physical therapist and you're not compensated well, why would you spend 2 extra years of training at an even poorer salary to go and get extra training for something that's not going to benefit you or your family in the long run? Research into this topic is also lacking. We're using the same treatment options for the past 20 years and looking for newer methods, but we need funding from the government. The other thing is just a lack of the number of specialists. There are wait lists of 6 months because there are too many patients and there's only a few or a specific type of doctor who can treat this.